Walking on air, and every day, every way, I feel I can't lose. I wanna shout it out, ain't no limit. I wanna shout it out to the world.
On. We're now unmuted. Welcome to Wellness Wednesdays with Dr. Wynn, OBGYN. We're going to be talking about breast health today. And I am hoping that you guys will have lots of questions to go over, and we can just talk about breast health and what to expect. So when we talk about breast health, it's one of the things that's very important when we are caring for ourselves. Breast health, while it may be something that we don't think about on a regular basis, other than just getting up, putting a bra on in the morning and making sure it looks right under our clothes, you know, some of us are fearful of the things that we need to do to make sure that we are doing well and that our breast care is appropriate and that we are investigating or evaluating for precancerous or cancerous cells in the breast. So one of the things that people talk about all the time is mammograms. I have had patients come in and they are concerned about mammograms. They have heard that they hurt. They don't want to be exposed to the radiation that comes along with a mammogram. So for some women who have never had them, they'll be very fearful. They may not even go to the OBGYN, may not talk about it, and they just kind of ignore it until there's a problem. So when we talk about breast health, when you are going to the OBGYN, part of your annual exam will include a breast exam. Now, there are many changes in many different organizations that will have what their recommendations are for that organization. Now, all those organizations may not agree. There is the American College of OBGYN, and there is the American Cancer Society. So everyone may have their own recommendations. OBGYNs typically tend to follow the American College or American Congress of OBGYN recommendations. So typically, when you have your annual exam done every 1 to 3 years, you will have your breast exam done. Now, that breast exam will be looking for changes in the skin, looking for changes in the nipple contour texture. Are there any lumps, bumps? Are there any swollen lymph nodes or anything like that? And so when we are doing those evaluations, typically how I approach it with the patient, I will go ahead, have them sit down, and I'll take a look at the breast while they're sitting up, just to make sure that the size is equivalent on both sides. If not, just checking for what we call asymmetry. Is one larger than the other? Does it look like the nipples are not, they're not extended like they should be, or are they retracted? Are they depressed? And so those are some of the things that we will look for. In addition to that, we'll have you lay back and we will examine one side at a time. And what we're looking for, are there lumps? Again, am I feeling anything? A lot of times I will talk with the patient and say, hey, have you had any problems? Are there any concerns that you have? Is there a place that you would like me to focus on? And so I will go ahead and examine the normal breast, or the side that they have no complaints about first. And then I'll go ahead and move to the opposite side. So, when we are doing that evaluation, if there's discomfort or you're having something that just doesn't feel normal to you, we always want you to let us know while we're there doing the exam. Okay. We'll also, a lot of times we'll start at the nipple and then we'll kind of go around in the circle of pinwheel area and then we'll go up kind of into the armpit and we'll fill into the armpit and make sure there are no lumps or bumps there as well. So there are times when women say, well, hey, I'm not sure if I'm due for my breast exam or my mammogram. What I will tell them is typically we start screening at about age 40 when it comes to mammograms, but breast exams can start far before that. We may start those breast exams at the age of 25, some maybe even sooner. And those breast exams done in the office can be done about every 1 to 3 years. Mammogram wise, for someone that is very low risk for breast cancer or breast disorders, though that evaluation with the mammogram may not be done until you are 40. But if you have a family history, if you have a personal history of breast cancer or a personal history of ovarian cancer or other genetic disorders, those mammograms may be done sooner. You also may have other forms of breast imaging as well, such as MRIs or ultrasounds. So, as far as that imaging is concerned, it is variable depending on what your own personal history may be. So, um, I'm trying to stream to 2 different platforms today. So if you see me looking back and forth, I am testing out some new things today. So bear with me. Again, if you do have questions, please go ahead and post them so we can get started with answering those. As far as mammograms, I've had some patients, they will say, I don't want to know. I don't want to get a mammogram. And guess what? When it comes down to it, if I get breast cancer, hey, so what? I've actually had patients tell me this. And my question always to that I pose to the patient is, well, so if we could find something that would save your life, that would take limited treatment and allow you to live another 20, 30 years on this earth, would you want to do that? And the perspective for most patients, they start to look at it a little bit differently. I think fear is what keeps people from pursuing evaluation. And, there are some people that may get breast cancer really early on, maybe in their 30s. I've had some patients that are early 30s, 31, 32, and it's advanced breast cancer. So what we want is to make sure that patients are aware of the evaluation and what they need to do in order to make sure that if there is by chance any breast cancer that occurs, it's identified early. In the 70s, 5-year cancer survival rate may have been only 75%. Now it's over 90%. So there's a lot of things that can be done to help save a woman's life. And when we talk about African American women, we are typically identified, breast cancer is typically identified in us at later stages. And so our survival rate may not be as great as other populations because we're not getting the screening that we need or that's necessary. So those are some of the things that are really important when we talk about moving forward. Excuse my dogs. Moving forward and making sure we're taking care of our breast health. So one of the things that we also used to talk about with women was doing their own breast exams, self-breast exams at home. And we used to tell you to do them every month, do them in the shower. We had placards that we'd have you hang from your shower head as a reminder. Well, we're not really pushing that as much anymore. We're more talking about self-breast awareness. So what does that mean? What that means is really understanding, what do your breasts look like? What do they feel like? Recognizing if you have pain or discomfort. You want to call the doctor and say, hey, I noticed something that's different. But what we don't want you doing is examining them too frequently, because what may happen quite often is that we identify something that may not be a problem, and it ends up promoting anxiety, and you end up having evaluation and things done that may not necessarily be needed. So other things that I like to talk to patients about in regards to breast health are making sure that you're wearing the appropriate fitted bra. So when we talk about bra fitting and breast pain, those two can sometimes go hand in hand if your bra is not fitted appropriately, whether it's too large or too small, whether the straps are not being worn appropriately, whether it's not the right shape for your breast. So, if the breast tissue is not supported appropriately, there are some women that may experience increase in breast pain. Well, hello. Welcome in, Felicia. Welcome, cousin. I see. Hello. How are you? There is a question that she has. Should you be concerned if you have a small amount of white liquid coming from your nipples? Also, sometimes if you get a shooting, burning sensation in your breast. Cool it. Cool it. So that is also something that I'm going to address. So I'm going to hang on to that question and I'll answer that in just a moment. I'll answer that in just a moment. So when we are going back to the bra fitting, so you want to make sure that the bra is fitted appropriately, again, because you may have pain and tenderness if you are not wearing the bra appropriately or appropriately sized. So you want to make sure that you are fitted appropriately and make sure that there is not gaping space between the straps, that the straps are large enough for your breast size, and that the band is appropriate as well. Also, that the cup size is appropriate. Okay. And it's very important, especially in young ladies, to have them taken to be fitted appropriately as well. Most of the women that I see come in and they're complaining of breast pain, typically I'll go through bra fitting with them and make sure that they recognize that that they need to be fitted appropriately. Well, welcome in, Christina. Welcome in. Hopefully you have some questions that I'll be able to answer as well. So when it comes to the question that we had just a few minutes ago, if you're having breast discharge, remember that's one of the things I said, that you want to make sure, if you're experiencing that, you will bring that to the attention of your physician. There are different reasons for breast discharge. Sometimes that breast discharge may be present because you recently completed breastfeeding, whether that was 6 months ago or whether that was 12 months ago. Sometimes if there's continued nipple stimulation, you may also have continued milk production. The other things that can happen, and there's a question here talking about prolactin levels and the connection between lactating breast and women who has not had a child. So that's one of the things that I was going to discuss. Excuse me for just one moment. So sorry about that. So there are different hormones in our system that come from the brain. And when those hormones are not functioning appropriately, you will have higher levels than you need. And what will happen is the breast will overproduce, we call it galactorrhea, overproduce a white substance that is similar to milk. And so when you have that elevation, what typically will happen, if you come to the doctor's office and you say, hey, I'm having some breast discharge, we'll do a breast exam on both sides. We will actually try to stimulate the breast to see if we can see that discharge, identify it. Sometimes it may be white, sometimes it may be green. I've seen red. There are different, I've seen clear as well. So those things mean different things. And depending on what we see on your physical exam, we may do additional blood work as well as breast imaging. So that is something that we need to evaluate further. So if you're having any of those concerns, you definitely want to seek out care with your OBGYN for further evaluation. Also, sometimes if you get a shooting, burning sensation in your breast, again, if you're having breast discomfort, there can be a number of things that are causing it. It could be because there's a breast infection. It could be because there is some cancerous cells there, but that's not going to be the first thing to think about when you have breast pain, because not all women with breast cancer have breast pain. Okay. And additionally, again, it could be because you're wearing an inappropriate size or ill-fitted bra. Additionally, I've had women that consume large amounts of caffeine. They may have significant breast discomfort as well. So there are many different things that can cause breast discomfort. And so you want to, if you're having those concerns, schedule an appointment with your physician so that you can have a further evaluation and breast exam. Are there any other questions, brewing questions that you have? Okay, I am testing out some additional streaming today. So I am going to look to see if I can determine if there are any questions as well. So let me pull that up and see if we have more questions, guys. Okay. I don't see any questions on our other thread as well. Okay, very good. Well, welcome, Asia. So let's see. Her question is, I am HER2 positive and I've never understood the differences in breast cancers. So when we look at types of breast cancers, what happens is the tissue that is collected, so we call it pathology. So whenever there are lumps or whole breast tissue that's removed, what will happen is that will be sent to a lab, and a physician called a pathologist will examine that tissue and they will test it for different receptors. So those receptors that they're testing for, that's where the HER2 positive comes from. So there you have abnormal HER receptor and it's positive. So that is how they determine the treatment that you will receive versus someone that has an estrogen receptor positive or progesterone receptor positive. And so breast cancers, they come in all different shapes, sizes, and receptor types. And so I'm not an oncologist. I'm not a specialist in that area. But what I would say is what I'm giving you is kind of the basic information when we talk about that. So we're talking about the receptors. Again, that's how they determine the types of treatment or the length of treatment that you may need. What are the top things you notice about lack of self-care? Can you clarify that for me, Christina? I just want to make sure I'm answering the question that you're asking. Welcome, Dr. Nikisha. What age, her question is, what age do you recommend stopping mammograms? So mammograms are recommended to be discontinued at the age of 75. And you say, well, that seems like an arbitrary random number. Why would we stop breast imaging at 75? Well, the thought process behind that is breast cancer may take that time frame of 10 years or so. Say the average age of length of life may be 85. If we're stopping at 75, something else is probably going to take you out prior to breast cancer taking you out. So that's kind of the best way I could try to explain that is we stop it at 75 unless there is some other issue that you may have. Next question. Well, hello, Sister Ebony. Welcome in. I'm glad you're here. I'm glad you were able to catch it. Hello, Deanna. Thank you for joining. Okay, so Christina asked, meaning women not doing breast check at home. Okay, so again, going back to breast exams at home, it used to be recommended that they were performed once a month. That is no longer the recommendation. The recommendation at this time is to have something called breast self-awareness. So that's making sure you know what your breasts look like, what they feel like. If you see something new, you see a change, you see that the nipples are now inverted or depressed where before they were not depressed, those are reasons why you will want to call your physician to schedule an in-person appointment for a breast exam. So I hope that answered the question. When it comes to not having anything done, that's where the concern comes in. We want to make sure that we are evaluating those breasts, that you are not skipping out on your visits. I've had some people that'll say, "Oh, I think I'm due for my mammogram. Why do I need to see the doctor to get an order for my mammogram?" Well, the doctor is going to be the one that report is sent to. And so you can't just show up at the breast care center to have a mammogram done, because a physician, typically we like to do your breast exam prior to giving you an order for a mammogram. Well, why is that? Well, there are different types of mammograms. There are different type of breast imaging, as I discussed before. So if you are having a breast, you're younger, we're not going to necessarily send you for a mammogram. We may send you for a breast ultrasound. So that's why it's important to have an exam and talk with your OBGYN or your family practitioner who may do your breast care, so you can make sure that you're having the appropriate exam and appropriate imaging. Well, hello, Sora Keisha. I appreciate you joining. If you guys have any additional questions, go ahead and drop them in the comments. I want to make sure that we're keeping up the content that you want to hear, and that we are moving in a direction that helps to improve women's health and wellness. So again, today we were talking about breast health care. And let's see, are there any other questions over here? I'm happy to have you all here today. I'm happy to have all the questions. And if you're watching this, not live, but when it's posted later, please go ahead and drop those comments in the comment section. Drop those questions in the comment section so that we can go ahead and continue to help provide information that can move us towards better health and wellness. While we're talking about breast health and breast care, also things that I would like to share with you. We need to know our family history. Whenever you go to the physician, we ask a ton of questions. We know that. You get tired of it. The nurse asks you questions. We ask you questions. You have to fill out questionnaires. And you're like, really, why do I need to do this so many times? Why do I need to do this every year? I just did it last year. Well, health changes over the years. Family history changes over the years. But one of the most important things that I like to make sure that women do is talk to their moms, talk to their daughters, talk to their sisters. Why is that important? There are genes that can go through families that will put you at a higher risk for breast cancer, ovarian cancer, colon cancer, a number of different types of familial gene disorders. And so what I like to make sure I do is, when talking to patients at their visits, asking about that family history. And a lot of women will say, well, my mom doesn't tell me about that, or my mom doesn't talk to me about that. Or they may say, my mom had breast cancer. Well, it's important to know when she was diagnosed. Did she have to have surgery? Did she have to have chemo? Did she have to have radiation? How long ago was she diagnosed? Is she still living? Did she have any other type of cancers or other disorders? Those are all important. In addition to that, sisters, if you've had sisters that have had breast cancer, ovarian cancer, and the like, you want to make sure that you are discussing that with them if they're open to sharing that information, because that will be important when we are sending you on for further evaluation and doing your genetic diagram. So that is important. We have additional question. One more question. What about moles growing on your breast? So let's talk about moles and skin. So remember I said skin changes. So skin changes can include changes in color, new what we call lesions or spots that are on the breast, as well as texture. So specifically talking about moles. So moles occur all the time, all over the body. And when we are evaluating moles, we look for many different things. We look for color. We look for symmetry. So is it even on both sides? We look at the border. We look at the depth. Is there anything, ulcerations or sores or anything associated with the moles? So if you've got a new spot and any of that is occurring, you want to contact your physician, schedule an appointment, and have them look at it and evaluate it. Sometimes all it takes is a simple biopsy to determine if there's something that you need to be concerned about. So that's why it's important to know what your breasts look like. Don't be afraid to go look in the mirror, take a look at your breasts and see, okay, this is what they look like this month, next month, or whatever, however often you will look at yourself in the mirror. There are some people that are afraid to do that. They're afraid to identify things, find things, but it's better to go ahead and figure something out sooner than later. Because remember what I said earlier detection is best. The earlier you detect it, the better the chance you may not have to go through the significant things that people have to go through when they have late stage or more advanced breast cancer and breast disease. I hope that this information is working for you and that you're getting to know and learn a lot. Again, when I'm doing these, I really just want to connect and make sure that if there are questions that you have, that we're able to go through them and really provide a platform for women to become more comfortable with their health and their wellness, become more comfortable with taking care of themselves and making sure that we're not always just taking care of everybody else and really forgetting about what it is that is important for us to be able to continue to take up care of other people. Because remember, whenever you get on the plane, they say, if the oxygen mask should come out of the ceiling, you got to put it on yourself before you can help anybody else. And so that's the same thing with our health. If we are continuing to focus on everyone else and not making sure that our health is in order, then we won't be around to be able to take care of those who may need us. So this is why I'm doing this. I have a passion for caring for women and making sure that, we're able to continue to grow and, have better health care for women. So my name is Dr. Wynn, Dr. Tanya Wynn. I'm a board certified OBGYN. I am a national speaker, soon to be author. I'm a mom and also a developer of a skincare line called Beautiful Soul. So I'm utilizing all of this, my passion for caring for women, making sure that you can identify your own health, your own beauty, and continue to support wellness. I want you to continue to follow me and follow our Wellness Wednesdays. We try to do them every week, every Wednesday at 7 p.m. It may not always be every week, but that is my goal, is to make sure that I'm present every Wednesday at 7 o'clock so that we can go ahead and have a conversation about women's health care and how to improve taking care of ourselves. So some of the upcoming topics that we may have coming up over the next few weeks, I'm going to do a session about grief. Just had a loss in the family, and everyone does not manage grief the same and are not always comfortable talking about grief. So I'm going to go ahead and start with grief coming up over the next few weeks. Also, self-care, meditation and mindset changes. So those are some of the things that will be coming up as well. It won't always be a physical health topic. There may be some mental health topics included as well. And also at some point, I'd like to talk about our physical health when it comes to weight management and some of those things that are more difficult for some of us. So if you have any additional questions, go ahead and drop them in the comment section. And please share this video, like, and follow me so that you can stay up to date on what we're going to be talking about. It was a pleasure. Welcome in, Dr. Jackson, Dr. Melissa Jackson. Thank you for joining. Again, go ahead and like and share and follow so that we can improve our exposure and improve the ability to improve women's health and wellness. So thank you so much. You guys have a blessed evening.